Hi, it's Dr. Rachel Brown with Business Health Solutions at Prisma Health, and this is the weekly COVID and wellness update. Two things right off the bat. I want to let you know that today is April 24th, so keep in mind information changes quickly, although we've had kind of a lull in a change of recommendations and procedures and information, except for around that Johnson & Johnson vaccine, which we'll talk about in just a second. The second thing I want to make you aware of is that we are going to start doing these updates every other week, unless, of course, something big happens and we need to share new and breaking information with you. So please tune in every other week to these updates and please share them with your workforce so that they have the information as well. So we'll start out with a quick status report. The percent positive in South Carolina remains at 4.8%. I say remains, but actually that's a slight uptick. And we did see a couple of counties join that high risk incidence category again this week. They are just above that 200 cases per 100,000 folks in that county mark. But it does seem to be going in the wrong direction. So we do need to remain vigilant. The good news is the vaccine trend still continues to move forward. About 28% of our population in South Carolina is fully vaccinated, and 40% is at least partially vaccinated, has some immunity, so has gotten either one dose of the Pfizer or one dose of the Moderna. Now, this is still not a high enough percentage for us to feel like we've reached herd immunity and can begin relaxing some of the precautions. So this is a time for you all as organizations to really encourage your employees to talk about the vaccine, get their questions answered, because those who are on the fence could really maybe use some empowerment to make a decision that might mean them getting the vaccine. We really need to see a higher percentage of folks getting the vaccine if we want to see a change in our risk status and in some of the behaviors and habits that we've been asked to adopt. So we're not trying to push anyone who really is not interested in getting the vaccine into doing that. But for folks who are ambivalent or just haven't had their questions answered, we're missing a huge opportunity. So please reach out to us. I am happy to host information sessions and Q&A sessions with your workforce. I've already been doing that for some other organizations. We've seen the folks who are interested in getting the vaccine right off the bat get it, right? We now are in that place where supply is actually greater than demand. So anyone who wants the vaccine can get it, but we're finding folks are still hesitant, some hesitancy, but mostly ambivalence. We're just not going to be able to get back to our regular way of life if that ambivalence continues. So please reach out to us to find out how we can encourage and empower your employees to get the vaccine. We're going to talk a little bit about, I'll show you some resources on how to get scheduled for the vaccine, how to find locations for the vaccine, and also how to find locations for testing. As the disease trend remains low, you're going to see vaccine clinics as well as testing drive-throughs change. And so, for instance, Prisma Health no longer has drive-through testing for COVID. That testing is done in the ambulatory practices. Okay, you're going to see mass vaccination hours reduce. So be sure to check the resources that I'll show you at the end of this video to make sure you have the best information for your employees. But let's talk a little bit about variants, some updates with the vaccines, and wearing masks, since that's the question I get asked most often. So as you know, there are many variants. There are several that have emerged as strains, meaning that they're very prevalent. And in fact, there is some data to suggest that most of the infections that we're seeing now in the US are actually caused by variants and not the novel coronavirus. DHEC and CDC are tracking this data, and they are testing more and more positive COVID tests for the genomes that indicate that they are the variants of the coronavirus. And what we are seeing also is a difference in behavior of the variants. So I've mentioned before in these videos that these variants tend to be more easily transmissible. Now, some folks have asked me, do these variants seem to be more dangerous and more severe for young people? Because we are seeing younger folks in the ICUs. We are seeing younger folks with more severe disease. And this is a difficult question to answer. It appears that the virus itself is not more virulent or more, does not cause more serious disease per se in younger people. But if you think about the fact that many, many older folks have been protected, they may be taking precautions more seriously, they are getting their vaccine. It's the younger crowd now that that virus has better access to infecting. And so now we've seen a shift in seeing more young people be more sick. That is likely due to the fact that the virus isn't infecting older people now. So we're seeing kind of the same numbers, just in a different age range. That coupled with long haul COVID syndrome, folks who are experiencing symptoms for even up to 6 months, are a lot of the reasons why we're still asking people to mask, right? This disease is still out there, and it still can cause serious consequences, hospitalization and death for all age groups. And so we need to mask. Young folks out there who may be feeling a little bit more immortal and a little bit at less risk need to understand that they are the people left who can be infected if they have not gotten vaccinated or if they're not wearing their masks. So please continue to encourage your workforce to follow those precautions. Let's talk about vaccine breakthrough cases. So folks will ask me, well, why bother getting the vaccine when you can still get COVID? Let me tell you that those breakthrough infections are usually due to variants, and we'll talk about the vaccine's efficacy against variants in just a moment. But the important thing is the number is very, very, very small. So far, as of about 48 hours ago, in the US, there were about 5,800, so 5,800 cases of breakthrough. So folks who have gotten the vaccine who also came down with COVID out of 77 million vaccinated people. That is a phenomenally small number. And I also want to point out here that it turns out only about 40% of those folks who had breakthrough infections were over the age of 60. Not sure why that is. It may be that older Americans are maybe more cautious because they do feel like they're at more risk. It may be because our younger folks are less cautious and more exposed to these variants. But it tends to be the younger than 60 crowd that's getting these breakthrough infections. In South Carolina, it's around 300 cases of all the variant types in South Carolina. And when you about how many million or how many folks have been vaccinated in South Carolina, 300 breakthrough cases is very, very, very low. The other good news is that if you have been vaccinated and you do indeed develop an infection, a breakthrough infection with COVID, it's looking like, according to the data, that your infection is much less severe. So even though you have been infected, okay, that vaccine didn't prevent infection, it's looking like that vaccine is preventing severe disease, which is really what we're shooting for, right? We want folks, if they do get infected, because no vaccine is perfect, that they have milder disease. They do not end up in the hospital. They do not end up with serious consequences. In fact, there's a study already that's come out that shows that Pfizer is probably about 94% effective against the UK variant. So we know the vaccines, even if they have a little bit less efficacy against the variants than they do the novel coronavirus, are still highly effective. And even if there's a breakthrough infection, that disease seems to be a lot less severe, okay? But it does mean it's still getting passed around. And again, that's why we're still being encouraged to wear masks. Now, as more and more people get vaccinated and the virus does not have the opportunity to spread because there are many fewer hosts for it to land on, then you're going to see some of those masking restrictions relax. And that's, again, another great reason why we want folks to get vaccinated. And you probably by now have heard that the CDC recommends no masking if folks who have been vaccinated are getting together. So if everyone around you is vaccinated, you don't have to take that. You don't have to wear that mask, which is really wonderful. They've even said if you're visiting another household and the folks there are of low risk, that you don't have to mask. And we think of this kind of as the grandparent rule. Grandparents who've been vaccinated and would like to visit their small grandchildren, as long as they're at low risk, that seems to be fine without masking. Let's talk really quickly on the Johnson & Johnson vaccine, or the Janssen vaccine. As you know, there was a pause due to 6 cases of a unique clotting situation, blood clot situation among women, young women who had gotten the Johnson & Johnson vaccine. As of yesterday, ACIP, CDC, and FDA have recommended that they remove that pause, but are working to amend the emergency use authorization, as well as fact sheets and other information that has been put out by around the Johnson & Johnson vaccine, so that folks receiving the vaccine and medical providers can caution young women around the risk that they may incur in getting a Johnson & Johnson vaccine. Now, keep in mind, the numbers are absolutely minuscule. So I would hate to discourage any young women from getting that Johnson & Johnson vaccine if they're not able to get a different vaccine. But your medical professional can help you decide whether you're at higher risk based on the kinds of medications you may be taking, based on any sort of clotting history in the past, and so on. And so I think we will see that Johnson & Johnson vaccine flood the market again. And remember, this is an incredibly effective vaccine. It does what it's supposed to do. It keeps people from getting the virus, but it also keeps those who do get the virus from getting severe disease, from being hospitalized, from having serious consequences and death from the virus. And it's just one shot. It's also very easy for vaccine administrators to handle, including you all as organizations if you host a vaccine clinic. Because it doesn't require that same level of deep freeze as the Pfizer vaccine. I've been getting asked a lot of questions about boosters. When will we need them? Will we need them? When will we need them? Who will get them? What does that look like? And what I can tell you is this: we will likely need a booster shot or a seasonal COVID vaccine, much like we do with flu. And that's about the extent of what we know right now. There hasn't been a lot of information shared around when that might be and who should start getting a booster. How long does the original vaccine last? The conventional feeling is that it lasts about a year, which is great. That will make it more of a seasonal kind of vaccine. We don't know if the vaccine, COVID vaccine, will be combined with the flu vaccine from some vendors. We don't know if we'll have to separate those like we are now. You can't get the COVID vaccine if you've had other vaccines within 14 days. So we have a lot of unanswered questions about this one. I think we should stay tuned. Of course, I will keep you up to date with the most recent information around this. But I think we can all anticipate that at the very least, the COVID vaccine will become a seasonal offering. All right, so want to talk a little bit in the last couple of minutes around workforce well-being. I have been working with some organizations and certainly within Prisma Health, and we recognize that it has been a long year and we still aren't seeing the progress that many of us would like to see. In other words, we'd love to just be back to our regular lives, right? Maybe our roles have changed. Maybe we're tired of wearing masks. Maybe we haven't seen folks in a long time. Maybe we're afraid of travel. Maybe we're just tired of hearing about this and talking about this. And so this is the time to turn to your workforce and tend to their wellness. Few recommendations here. Allowing your workforce to have a place where they can share their emotions, where they can feel psychological safety and talk about whether or not they're struggling and what they're struggling with, to receive support from others, and really just a place to vent. Okay, we all feel a little bit better when we can share and vent. This is a time to relook at your EAP policies and programming, and really emphasizing to your workforce that your EAP is not meant for folks who are in crisis. It's meant for folks who may be struggling just a little bit, or even folks who are doing pretty well but need an emotional well-being check-in. My goal for every organization is to develop a culture that normalizes visiting an EAP provider or counselor in the same way that you would normalize visiting your doctor each year for an annual visit. An annual physical wellness checkup is just at the same as having an annual emotional wellness checkup. So reframing those support programs so that folks understand that they don't have to be in crisis to access them, that everyone should maybe take some time to dip in and see how they're doing. We also provide stress coping sessions, as well as building resilient stress, building resilience sessions, which we can do either virtually or in person. And this is a special passion of mine, helping folks build resilience. So please reach out to us so that you can access these programs. I'm going to share some of the resources that I use in helping organizations to educate and manage expectations among their workforce, and manage protocols and policies for keeping them healthy. Just very quickly, remember this vaccine dashboard from South Carolina DHEC will keep us up to date on how many people are vaccinated and fully immune. This is too low a number. We need to get this number up. We also can visit that DHEC site, find a vaccine location. This will include Prisma Health locations, as well as retail pharmacies, other healthcare system vaccine administration sites, ambulatory care sites, and so on. Finding a testing location. So people with symptoms and exposure still need to be tested, even though we're not seeing that testing in the numbers that we were before. So you can find that location right there. If you're specifically going to use Prisma Health to get your vaccine, we do have a lot of access. You can go right here to our vaccine page, register for MyChart if you haven't already, and find a vaccination site. It's very easy. Took my 16-year-old daughter the other day, and I was in and out in less than 25 minutes. And that included a 15-minute observation period. And then finally, want to share with you our contact information. So if you go to Creating a Safer and Healthier Workplace, you can scroll down here, give us a call. Ask us your questions. Ask us to help educate your workforce. Ask us to help your workforce deal with stress and pursue emotional well-being. Whatever it is, we want to know how we can. Ask us how you can get your workforce to those mass vaccination sites, or get their vaccines, or how we can be on site to help you get the vaccines. We need more people to get those vaccines so that we can go back to that way of life and have that sense of well-being that we had before. Okay, remember, every 2 weeks from here on out, I will be back to share the latest and greatest information with you, but you can always reach out to us in real time if you have any questions. I'm happy to answer them, because we are here to care for you so you can care for your workforce.